Carroll, who's on the board of directors for the American Academy of Family Physicians. Dr. Carroll, thanks so much for joining us.
Hi, Tram.
Okay, here's our first question from Kevin. He texted us this. I heard that due to lack of testing, there may be 1 out of 3 people walking around with COVID-19. If you are one of those who are asymptomatic, how long should you self-isolate to become non-infectious?
So I probably would disagree with that statistic. I don't think it's 1 in 3. It's a much, much smaller number. If you've come into contact with someone you know that was positive on coronavirus testing and you spent time with them, you need to self-isolate, and you need to self-isolate for 14 full days. That's part of this whole stay-at-home movement. Is if we could get every single person to stay at home for 14 full days, we could probably eliminate the transmission of this virus pretty significantly. But of course, we're not going to do that. So that's why it still continues to transmit.
All right, Julie texted us this question. If I want to get tested, do I just go to my regular doctor?
So if you have symptoms, like you had the fever or the body aches, fever over 100.4, cough, shortness of breath, you should call your doctor first. Make sure that they're set up and ready for you to come in for testing, because we're going to want to isolate ourselves. We're going to want to put all our gear on. We're going to want to bring you in the back door or around people who aren't sick so that they don't get sick. And then you got to make sure that your doctor is seeing patients who are sick with COVID, because some doctors' offices aren't. Always call first. That's the most important thing. But yes, you should be calling your primary care physician.
Okay, good to know. Another viewer texted Team 12 asking, can you give it back and forth to each other? I am 65 and my husband is 75. He has heart problems.
So if you yourself have the coronavirus and unfortunately spending time with somebody who doesn't, and you're going to transmit it, they're going to get it. However, once you both have had it, and hopefully you've gotten through it okay and didn't get overly sick, you now hopefully have immunity. And we see that folks who have had the coronavirus, at least this strain, since the COVID-19 has not mutated, we believe that there's lifelong immunity, which is the hope behind a vaccine. Now, the sooner we can get a vaccine for this, the sooner we can provide immunity for everybody. And at that point, we could stop this disease dead in its tracks.
All right, and still, because this virus is so new, there's still so much to learn. So finally, Ron asked this, what extra steps are doctors taking to protect themselves and their families from corona? I saw a report on doctors living in trailers or tents to avoid exposing their families at home. Do doctors need help?
So we're trained. We trained for years for this. Beyond college, we've got another 7 to 11 years that we train for dealing with people with chronic diseases, especially infectious diseases. So that's why we wear the gowns and the shields and the masks and the hoods and the boots and the gloves. We do that because we know how to deal with these sorts of things. When we go home, we ideally don't even enter our home with the clothes that we wore to work. We've either put it in a bag to throw straight into our wash to sterilize, or we've taken them off at when we get home and put them away. Yes, there are a lot of doctors who are working in those ICUs that are not even going home. Some folks are sending their families to go be with other families so that when they come home, they don't expose their own families. So yes, we're all taking precautions, and we appreciate the public's help in understanding what we're having to deal with here.
All right, and finally, I want to ask a question from actually one of our staff members here, Cindy. She came out to me during the commercial break, was wondering about hand sanitizers. A lot of them are antibacterial. Can you explain the difference between bacteria versus a virus, and are these hand sanitizers really killing out the virus when we're using them? How effective are they?
Okay, so they say antibacterial because there might be a chemical in there called triclosan, which is an antibacterial you'll find in soap and other detergents that specifically breaks down bacteria, but not so specific for viruses. What you're looking for in a hand sanitizer is typically an alcohol-based hand sanitizer. Usually it has ethanol, ethyl alcohol, and you want between 60 and 70% of percentage of ethyl alcohol in that hand sanitizer. That pretty much kills everything. And so when you use it, make sure you put it on there. Don't dry your hands with a paper towel. It's that evaporation that kills the bacteria and the viruses viruses. So that's why you put it on and then you let your hands dry out, because that's what actually ends up killing those viruses. If you're buying something that's specifically antibacterial, you may not be killing viruses at the same time.
Excellent to know. So definitely look at the ingredients. Dr. Carroll, it is always great to have you on. We thank you so much for helping all of our viewers and our staff member too.
Thank you, Tram, and everybody please stay safe, wash your hands, stay away from other folks.
It's a good reminder. Thank you so much. Stay up to date on all the latest news by downloading the 12 News app for the facts, not fear, on coronavirus. And email us your questions on Facebook or text Team 12 at 602-444-1212. Up next, we